Hi, I'm Alexandra Reese, a labor and delivery registered nurse. Today I'm going to be discussing House Bill 236, sponsored by Deb Lavender. Direct quote from the bill states that it requires organizations that provide pregnancy-related services to provide medically accurate information regarding reproductive health options in order to receive state funding. So more or less what this bill is saying is that in order for an organization that provides services to receive money from the state, they have to be upfront and honest with the services they provide. As a nurse, a Christian, and a woman of childbearing age, this bill appeals to me. It appeals to me in the way that, from my medical professional side, I love that we have decided we need to be upfront and honest with our patients. Every patient has that right. There's no need to hide information from them. They deserve to know what options are available to them at a pregnancy center. For instance, some pregnancy centers offer information that dance around the idea of an abortion, but they never once state that they'll perform the abortion. A mom can go in, receive an exam, have an ultrasound, and at the end of the exam expect to have an abortion, and then someone walks in and says, "Oh no, we don't do the abortion here. You'll have to go somewhere else." That's not fair to the mom. What Deb's wanting to do is, in order for these programs to continue receiving state funding, they need to be upfront and honest with that information before the mom ever comes in. The program that they receive their state funding through is TANF. The way that TANF can provide funds for them is that they have 4 overarching goals, one of which is to prevent out-of-wedlock pregnancies. Since pregnancy resource centers or crisis pregnancy centers are doing exactly that, they can receive a portion of TANF cash in order to stay open and stay funded. However, it's really not fair to me that we're taking money from TANF and lying to moms about it. We're providing a state-funded service that may not be exactly what they need. Why are we taking money from TANF, which could be going to feed hungry children, and putting it into state-funded services that may not be everything the mom needs? Deb herself even stated that if clinics don't want to provide abortions, that's fine with her. They just need to be upfront and honest with the patients and not lie about the information that they give. For instance, one of the centers in Massachusetts, a study was done on pamphlets that were handed out to investigators posing as pregnant women, and the pamphlets that they handed out stated that an abortion increases the risk of developing breast cancer later in life. However, research done by the American Cancer Society proves that to be wrong. There's nothing that shows that there's a link there. That's not fair to the moms. We're lying to them. And as a healthcare professional, that really upsets me that we would do that to them at such a vital time in their life. So overall, I think that the bill is a really good idea. I think that we should be upfront and honest with our moms, and we shouldn't hide what we're doing. Especially if there are medical professionals at these crisis pregnancy centers, they should know that they need to be honest with these moms and not hide information. That's not right. It's not ethical. And I really like that Deb says that she doesn't think that they have to provide the abortion. They just need to be honest. And really, if that's all that this bill is going to do is require for a medical center to be honest, I would be fine with seeing it pass. However, if it passing is going to require all crisis pregnancy centers to perform the abortion, I would like to see it stop dead in its tracks. Morally, I'm not okay with abortions. However, I know that is an option that a lot of women want to see. But if the center is not going to perform the abortion, they need to have information for the moms about where else they can go and what other options there are, such as adoption. Thank you.